We're going to have question and answers. We haven't had too many questions during the day, but I'm not sure when you and Dr. Benjamin actually joined us. And I did want to reflect on one thing I had mentioned earlier. In our journal, we've received a couple of articles which try to assess the state of disaster medicine, to include climate change, et cetera, of the state of education and training or curriculum in those schools. And it finds that only about 25% of medical and nursing schools, I can't address schools of public health, they weren't looked at in these, but only 25% after all these years following 9/11 and all of the tragedies since then, do an adequate job in this area. Caitlin, you obviously stressed the need for education. And education in this area has to go beyond skills and knowledge. It has to make people aware of the kinds of things you and Dr. Benjamin presented. And then finally, how to be individual and community advocates for bringing change about. Where we're coming from is it's time to stop talking and discussing and time to start doing. We know what has to be done, but we don't get there. But just as one little piece of it, I've been asking this question all day, and I'd like to ask the same question to you and Dr. Benjamin. If there's one area you can identify in education and training that's deficient currently, one you'd correct, what would it be?
I'll go first. I think it's re-envisioning what research and engagement looks like. I'm so fortunate to have gotten my Master of Public Health, to have done a Climate and Health Policy Fellowship. And so it's very intuitive to me to work with all of these different disciplines. That is not the same for all of the medical students and residents who are trained. And so what does research look like? It's not just basic science. It's translating a project to inform policy and create change on a broader scale. And so what does that look like? That means I'm working with a meteorologist, an environmental scientist, an epidemiologist, a bioethicist, a philosopher, and we're having these discussions like we've been having all day on what does a new system looks like whereby health is incentivized and wellness is incentivized and whereby our community can be healthier.
Thank you.
And I think for me, Dr. James, we spend a lot of time teaching physicians to be independent thinkers. And I think we need to change the paradigm. I think we need to change the training of physicians so that they feel more engaged and more competent at working in medicine as a team sport and working across sectors. It doesn't mean that physicians should not play a leadership role, in some cases, the leadership role of the healthcare team. But I do think that we need to give people the skills to do a better job of working across sectors with other sectors, and people who aren't necessarily as knowledgeable of our language and our engagement, so that they can talk outside of the medical speak that we often use with communities.
And one of the goals we have translating all of this into education and training is to determine a model that really gets integrative training. And obviously that becomes difficult, not just in medicine, it's the same in nursing, it's the same in pharmacy. It's all stovepipe education. And we don't really get people to collaborate till later on in their careers. And that's usually only when something negative happens that forces them to collaborate. And they don't have the skills for it and they don't perform.